Okay, so we're here with Erin. How are you, Erin?
I'm doing great, thank you.
Good. And can you tell us what we did for you here?
I had rhinoplasty done.
Yeah, so Erin is about almost exactly 1 month.
Exactly
right?
1 month today.
After rhinoplasty, and she liked it so much she's going to come work for us here shortly. So you guys will be seeing Erin maybe as one of your consult coordinators. So we'll pull up some pictures here on the screen in a minute, but it's been about a month. And tell me, why did you proceed? Why were you looking for rhinoplasty?
I've always wanted to have rhinoplasty done. I mean, from the time I was little, I knew it was just something that I wanted to do. It was always out of proportion, and I felt really confident, but as I grew up, it just got worse and worse with my nose getting bigger. And I started to really grow into myself, and I liked everything else about myself but this one thing. And I figured I had the opportunity to change it, so I just went for it, and I could not be happier with the results and the whole process.
So Erin was one of our worst bruisers. She got bruised. I'd say 80% of our patients, we take their splint off at a week. We don't pack anybody. We take their splint off at a week, and they could go out to lunch. Erin, you probably took, what, 2 weeks?
I took 2 weeks.
That, right?
Yeah, and I was swelling all over here. I looked like a monster, but it was, I've got great pictures, but it was all worth it.
So even with that, you really were, you're probably one of our worst couple percent as far as bruises go. But even with that, by a month, I mean, she looks really, really good.
No regrets.
And pain-wise, be honest, pain-wise, how many days did you take pain pills?
Seriously, not bad at all. It was only a couple of days, and it was really mostly discomfort more than anything, the fact that I couldn't breathe out of my nose very well.
Yeah.
But really, it was not a painful procedure at all.
Yeah, that's what most people say. I'd say the average patient, say half of the patients take pain pills the first night, 10% take them a couple extra days, and that's about it. What most people complain about is stuffiness. Were you stuffy?
Yes, very stuffy. And I couldn't blow my nose, so
yeah,
I was like, I wish I could do that, but I can't.
So most people, we tell people to expect to be really stuffy over 2 or 3 weeks, kind of stuffy for another 2 or 3 months, and then breathe well. So that's pretty much it. Anything else you want to add?
Nope, I wouldn't. I mean, it was a little bit tough at times, but I would do it again in a heartbeat if I had to. So,
super.
And thank you so much.
Oh,
I really
you're welcome.
appreciate it.
So yeah, well, hopefully you guys come in and see Erin in person here shortly.
I can't wait.
Thank you.
Thank you.